like Mark, I just recently received a quote unquote promotion. So I'll just go ahead and share that. Last month in September, President Joe Biden appointed me to the USO Board of Governors. So I'm super excited about, having the opportunity to serve veterans and military families at yet another level. I'll just talk a little bit about Women Veterans Interactive and the presentation before me. I'm really intrigued with this whole nudging, but let me tell you what I do at Women Veterans Interactive first, and then I'll get into that portion of it. Women Veterans Interactive is a national membership nonprofit organization that has supported service women and women veterans for over 10 years. Women Veterans Interactive is a solutions-driven nonprofit organization focused on outreach and engagement. We enable and empower women veterans with the tools and resources needed to achieve post-military success. We accomplish our mission by operating on 3 pillars: wellness, transition, and safety. And, for today's discussion, I think, the wellness, transition, and safety, it all comes together nicely when we're talking about suicide amongst veterans. We heard the statistical data, so I won't get into that anymore, but I'm a strong believer that if we have 1 veteran a day committing suicide, that's 1 too many. Why are our veterans committing suicide? The transition is difficult for some veterans. Some veterans are feeling alone. Some veterans feel that they can't make it in the civilian sector. We have those veterans who have, participated in several wars that we have had in this country. And it's just difficult, to come back into the civilian sector and quote unquote, get yourself together without the proper resources. A couple of programs we have at WVI, we focus on women veterans who are homeless, at risk of being homeless. We have a financial literacy program. But even with all of the programs that we have, if our main undergirth was not rooted in outreach and engagement, then we would miss the mark every time. And one of the things I realized is that through our outreach and engagement efforts, we have captured like thousands of women veterans in this net. And, a lot of whom along this journey have been suicidal. And it's sad to see, someone, especially a woman veteran with children, who is suffering from depression, anxiety, PTSD, military sexual trauma. And when they get to that suicidal state, sometimes it's hard to bring them back. And then there's other times, more often than not, just by being amongst your peers and other people that you have served with, it kind of makes the difference. But to the point of nudging, I'm very intrigued, with this whole nudging process, with using technology. If we can reach veterans at the right time through nudging and technology, then I truly believe we can cut down on suicide. I'm a big fan of social media. I'm a marketing, guru. I'm always on Facebook, LinkedIn, whatever. And I get nudged so much. So when you talk about nudging, like I never knew there was a terminology for that. Like I've seen something to come across like a pair of shoes that keep nudging me almost like every day. And I said, you know what? If I see those shoes come across one more time, I'm going to purchase those shoes. So I didn't know like that was a thing. So I'm saying to myself, okay, in the veteran community, a lot of veterans who are suffering from depression, they may not get out a lot, right? One of the things I noticed through the pandemic, when we did a pink and white empowerment virtual brunch, we did it every Monday from 12 to 1, from like May to June. We had women veterans showing up from around the country. Normally we would do this in person, but due to COVID, we had to make it virtual. The point I'm driving home is this. There were so many women who were hiding behind their computers, but would get dressed up every Monday to put that pink and white on, like to show their face. And then they would admit like, okay, I'm dealing with depression. I'm dealing with these issues, quote unquote, my computer and my smartphone is my best friend. So how do you combine that, as in the previous conversation, with proven methodologies? How do we combine that to really reach veterans where they are? And I think oftentimes the most, that's where a lot of service organizations miss it, because we want the veterans to come to us. A lot of times folks who are suffering from depression are not going to come to us. But if we had a way to get to them through something that I'm on this line here and I have my cell phone. So if I'm feeling any kind of way, I may not get up and go see somebody, but I may open my cell phone up to get on social media feeling depressed that day. And if I can be nudged, to go to the VA or to call that hotline, then, we're probably going to save a life that way. Thank you.
So this is a question for Ginger. And Ginger, as you think about the areas to support our veterans and those with mental issues that you deal with, what might be some of their specific needs? What do you see as some areas that we ought to consider focusing on to make it more beneficial to engage our veterans as they come out of military duty into more civil life?
Well, thank you for that question, Dr. 𝗚𝗏𝗏. I think peer-to-peer interaction, having these conversations with your peers, having folks who have been suicidal, to talk to folks as they are transitioning out of the military, because then you have these real world stories. And a lot of times veterans may feel isolated. They may feel that they are the only ones feeling suicidal, which is probably so far from the truth. So I think, having these difficult conversations in areas that may be free and inviting, maybe over like a coffee conversation, something similar to that. But I think it's important because when Mark was talking about his friend, I remember seeing that. And Mark, I'm so sorry, but I remember seeing that on social media. Like I'm Navy, so I didn't know who he was, but I'm attached to like a lot of Army folks who went to West Point on Facebook. But it just goes to show you how that message gets out on social media. And to your point, Mark, nobody said what happened. They were all just sorry that it happened, right? And nobody wanted to discuss that elephant in the room because Rob was such a giant amongst us. You understand? But if we could have had a conversation amongst giants, one of the things I find it, and I think I'm probably going to even write a book, like, where do we go as leaders to lick our wounds? Society has this thing where if you served in the military, you have to be tough. You can't lick your wounds in the open because it's a sign of weakness. And in all actuality, it's not a sign of weakness to lick our wounds. So to your point, and to answer your question, I think we have to create these atmospheres where it's okay for leaders from the top down to say that I'm not okay, that I need help. And I think that would really start the momentum to diving into, this issue that we have with veterans and suicide.
And Ginger, I'm going to ask one more question on that topic before I switch to a slightly different topic about designing nudges. And I thought I might ask you this. You heard Mark and Dr. 𝗏𝗏𝗏 talk about access and access points. But even if access points were made available, and if they were made available much more upstream, how should we look at initiation? How should we look at getting people to, do the simple act of downloading the app or getting initiated? What in your opinion would be approaches that we might consider to get that initiation going? Any thoughts on that?
Oh, absolutely. One of the things that we pride ourselves on at Women Veterans Interactive is meeting women veterans at their points of needs. We go into the communities where these women veterans live, work, and play. We have designed our outreach in such a way to where it's very open and inviting to the woman at heart. And then once we grab you by the heart, we grab you by the mind and give you all of these tools and resources that you need. So, it's just a matter of how you outreach and engage. I wouldn't recommend saying, some people, I love the whole concept of nudging, because if you say, are you depressed? Are you suicidal? Most folks are going to say no. They're not going to own up to that. But if you're in an environment where it says, okay, you know what, we have this app. Did you know about this tool? Like in an indirect manner, in a nudging manner, present this to someone. You make these tools and resources available, but how you present it to a veteran, I think is going to make the difference. We have never had a problem reaching women veterans with whatever we wanted to do, because, we support the woman based upon her service to the country. So, you know, what is that real need? You know, how do you really get them through the door is going to make the difference. And this is why I'm excited to continue this conversation about the nudging, because it's like a soft tap on the shoulder. And then you look and it's just like, you know, I can reach out to this resource confidentially. Nobody's going to know that I'm depressed, but I know I need help. So I'm going to reach out because it's confidential. One life at a time, and then another, and then another.